We frequently talk about what we should be doing to manage our weight, but at what point does a weight problem turn into a case of obesity, and what can you do about it? Dr. Mark Opperman joins us in studio today to help us get a better understanding of this disease. Mark, let's start with the holy grail of things, which is a definition, because we need some context. So what constitutes obesity? Because there is quite a lot of confusion around what this actually is.
Actually, Michael, obesity is classified or refers to an abnormal collection of fat in the body. There's different ways of measuring it. The standard way is to do a body mass index.
Right.
Now, a body mass index is where you take your weight and you take your height in centimeters, and it's a ratio between the two. So you take your centimeters and times it by the centimeters. So I'm 1.75, so it's 1.75 times 1.75, and the answer that you get is the weight, the height ratio.
Right.
And then you take your weight and you divide it by your height, and that gives you your body mass index.
Okay.
So it's very confusing, and in the medical fraternity, we're starting to see it as quite archaic, although the World Health Organization still use it. And to illustrate this, if you look at me, I weigh 86 kilograms, and I'm 175 centimeters long, and that gives me a body mass index of close to 29. Now, if you are overweight, for men, your body mass index is above 25.
Okay.
And obesity starts with a body mass index of 30.
Right.
So for people who are active and muscled, you know what, this is really not an accurate
Absolutely.
reading. And just ask anyone that goes for their discovery test. And they said, okay, you are overweight. The better way of doing it now is actually to look at your waist-hip ratio or just your waist circumference.
Okay.
For men, a normal healthy waist circumference is below 94 centimeters.
Okay.
And for women, it's below 85. You get a problem, or you go into a high-risk area between 94 and 102. And if you're over 102, you really have a problem.
Okay.
So I think understanding that it's abnormal collection of fat, and the way that you look at it is a waist circumference of above 100 centimeters for men and above 88 for women.
Okay. So now, Mark, at this day and age, I mean, what is the prevalence of obesity in society, and how has that changed over the years?
Michael, it's actually scaring. Since 1975, the incidence of obesity have tripled.
Sure.
In 2016, 40% of adults were overweight, and 19% of adults were obese.
Sure. That's a huge amount.
Those numbers have increased in the past 7 years. But what makes it actually even more scary is that children between the ages of 5 and 19, the incidence of overweight and obesity is as high as 43%.
Heavens, sure.
And this is a problem on various fields. Number one, the health problem that you have as an individual, but also the burden that this places on governments and health institutions. So it becomes a socio-economic problem as well.
Absolutely. Mark, I just think we need to touch on the fact that we're talking about obesity, we're talking about people who are overweight, and there's a huge movement these days around body positivity and all of those things, which on one level is great, but as you mentioned now, it's a health problem. And
it's a pandemic.
You can be super proud of your body, but if you have a health problem, you need to acknowledge that.
Michael, I think let's take a look at the causes of obesity. So the first cause is when you have excessive amounts of calorie intake versus the amount of calories that you burn.
Right, right.
And those extra calories will be stored as fat. So it's that energy intake versus energy expenditure.
Absolutely.
But that's not the beginning and end all of it all. It's not only about eating, and it's not only about exercising. There are other conditions that play a role here. Genetics, number one.
Right.
Other hormone imbalances. And the last time we were on the show, we spoke about metabolic disease and insulin resistance.
Yes.
So insulin resistance is a hormonal issue. Your thyroid, if your thyroid's not functioning properly, it creates a condition where you're prone to obesity. We also have to go and look at other lifestyle factors. Sleep. If you do not sleep adequately, you will gain weight. Our gut, the microbiome, is so important. The organism in your gut is responsible for digesting food. Without them, you can't survive. Now, if we have a dysbiosis, if this gut organisms aren't functioning properly or over-functioning, they produce too much energy sometimes.
Right.
And this is where you find that people that say, but I don't eat a lot. Why am I gaining the weight? It's because the food that you are taking in is changed in such a way into energy that it's excessive, and certain of your gut bacteria can do that. So it's not only about eating or not being active, it's actually about so many other things that contribute to the fact that we overeat. And when we look at food, it's the calorie-dense stuff. It's sugars, salts, and fats.
And highly processed, all of them.
All of them.
Yeah. Mark, I'd like to dive a little bit deeper into the point of genetics, which you mentioned earlier. So, I mean, there's this attitude sometimes that, oh, I come from, my parents were overweight, so I'm destined to be overweight. So that's how it works. Is that in any way true?
Michael, to a degree, yes. Because if there were genetic factors in the parents, it's a possibility that you also might have those genetic abnormalities. And again, it can be autoimmune diseases, it can be diseases that's associated with inflammation, and inflammation will do that. There's also the lifestyle that you get accustomed to. It's quite interesting to note that in low and middle income countries, you often find obesity and malnutrition or undernutrition in the same household. And it's got to do with both lifestyle, genetics, and social environmental factors that play a role. Genetics is something that you can't disregard in obesity, but I don't think that you can use it as an excuse either. Right.
If somebody is dealing with obesity and they're struggling, is it advisable that they would come and speak to a practitioner who can sort of formulate a plan and delve into the deeper detail, blood tests and things like that, to understand the bigger picture in order to sort of create a roadmap?
Absolutely, Michael. In 2019, obesity was classified as a chronic disease. So it's a medical condition and it should be treated as one.
Right.
You need to have an understanding of the patient's medical history and current medical state to be able to marry biochemistry, and that refers to the blood tests.
Yes.
You need to understand the patient's medical history and current medical state. And when you do that, you can now take the biochemistry, the blood results, and you can marry the two. You need to do that in order to formulate a treatment protocol which the patient can implement.
Yes.
Not only lifestyle changes, because lifestyle changes might often not be enough, but supportive medication in the form of treatments that work on their thyroid hormone or that work on the insulin resistance. I think one of the most important things for us to understand when you want to embark on a weight loss journey is that you need support. You need the support from your family or the people around you, and you need medical support.
Right.
The body needs to be able to detox. We store toxins in fat. So it's the preparation work that you need to do to embark on this journey in order to be successful.
Okay. So Mark, anyone who wants to maybe get in touch with you to find out a little bit more about how they can go through this process, how do they get hold of you?
You know what, the easiest to get hold of us via social media, Facebook, Instagram, but we are available in Johannesburg. The telephone number is 010-824-1393.
Wonderful. Mark, thank you so much. We will have you back so that we can dive into sort of the game plan around managing obesity, but for now, thank you for your insights.